All right, let's do this, Bobo. 7:32.
Philadelphia has lifted many of its remaining COVID restrictions.
As of yesterday, you know that more than 600,000 people are fully vaccinated in Philadelphia, and just over 800,000 others have received at least one dose. So under the new guidance, masks are still required indoors. You still got to wear a mask indoors, okay? But that could change maybe as early as the 11th of this month. Acting Philadelphia Health Commissioner Dr. Cheryl Bettigole joins us now. Hello, doctor.
Good morning. How are you?
Have you ever been on our show?
I don't think so. No.
Well, you'd probably remember because it's quite the
Yes.
experience.
That's true. No, I have not.
Welcome.
So we still got
Thank
to,
you.
I mean, everything's kind of back to normal, except you got to wear the mask inside, right?
That's correct. Yeah, and we still have the last call for dining at 11 p.m. But otherwise, really heading back toward normal in Philadelphia.
It really is. Now, it seems like we've in Philly have always been kind of extra careful, a little bit behind the other states, including our own. Would you say the same thing, that we maybe been a little more careful than others?
You know, we've been a little bit more careful. I think that carefulness has saved a lot of lives in Philly. If you look at the curves, especially that big winter surge that the surrounding counties saw, things have been a little bit safer in Philly. So that cautiousness has been important to us.
When do you think those masks are coming off in Philly?
We're going to look at all the data on the week of June 7th. And we're also reaching out to the business community because we're hearing some businesses saying that they have concerns. So we want to make sure we understand those first.
Okay.
That's important. At one point, we were worried about not enough folks wanting to get the vaccine, and recently. Does this mean then that since a lot of the restrictions are dropping, that, hey, we've reached enough when it comes to how many people have been vaccinated, or there still needs to be a big push?
So it's both, right? So we have, many more people in Philly vaccinated, and we need to do a big push. So my biggest concern is if we were to see another, I don't think it would be a huge surge, but a fall uptick at least, that we have some neighborhoods, some pockets where we have larger numbers of unvaccinated people. And they're not necessarily scattered evenly across the city. So the idea that they would be protected by the vaccinated people doesn't necessarily work. So we're continuing to do lots of outreach. We've reached this stage, I've said this a few times before, we've reached a stage with the pandemic where we need to get vaccines to people and not people to
What sections of the city aren't getting vaccinated enough yet?
So it's pockets. We're looking no longer by zip code, but by census tract, and identifying the neighborhoods that we need to be in and trying to get pop-ups there.
Okay.
But with this happening, because of course, by the time the fall comes, I mean, hopefully everybody will be fully open. We are expecting some sort of uptick then, for sure?
No, we're hoping not. The work we're doing right now is to try to prevent that fall uptick.
Yeah. I suppose you heard about this Vietnam variant now. It seems to be an offshoot of India and the UK. You seen anything like that here?
Well, there are variants in Philly, although certainly not that variant yet. But we will continue to see variants. Viruses mutate. And the best protection that we're seeing against the variants is vaccines. So especially being fully vaccinated. So a lot of people get that first dose and they think, maybe I don't need the second. But it's the 2 doses or being fully vaccinated with Johnson & Johnson. That's where we get our full protection.
And then we just did a story about the rare bird flu case that was recently found in China. Now, it's only one, and they said they're not sure if it can spread. But Mike mentioned when we were reading the story, we have heard that before. What have you heard about this rare strain of the bird flu?
Yeah, so this is the first case of that particular bird flu. But there are bird flus. They're typically like this. You see a case or a very small number of cases. They're much more dangerous, but rarely very transmissible. But the danger is if they combine in a single person with somebody who has flu.
Yeah.
And then you can get some crossing of the viruses and you can get something that is both more dangerous and transmissible.
We're lucky to have you because I know you've studied bird flu extensively over the years. So it's nice to have your expertise. Can I just maybe have a little bit of fun with you here? Have y'all there at the health department considered doing what New York did? They had a $5 million lottery if you got vaccinated, In Ohio, they give away $1 million every Thursday for 5 Thursdays if you get vaccinated. Now, in New Mexico, they're up to $10 million worth of fun stuff and prizes, Doctor. Why can't we do that here?
We are working on incentives in
What?
Philly. And yeah, we are. A whole variety of incentives. So our sports teams have stepped up and they've been doing some donations, not in the millions of dollars, but Sixers gear, for example, which ought to be popular this week. And the Eagles are stepping up. So we've had a variety of those kinds of incentives, and we are working on some other incentive projects.
I want more than a
hopefully will be
t-shirt,
enough.
Doctor. I don't want to be rude.
She said they're working on more, so we can't wait to hear what
It's
the
coming.
more is.
It's coming.
All right.
Thank you much. Come back anytime, please.
Yes, thank you, Doctor.
Thank you very much.
She's great. All right.